All right, hi there. I'm Dr. Donahue.
Hi.
We take care of you today.
Dinah.
Dinah, can you spell that for me?
Dinah.
Okay, last name?
Soar. Soar.
Soar. All right, a couple simple questions here. How old are you?
I'm 25.
25. And when's your date of birth?
Yeah. Don't have very good records.
All right. Okay, so what brings you in today, Dinah? Dina? Is it Dina or Dinah?
Dinah.
Dinah. Okay.
I have low back pain.
Low back. Can you point to it for me?
Yeah.
Okay, right in the middle there.
Yeah, about right here.
Low, middle. Okay. Alright. And what were you doing when this happened? How did it happen?
I bent over, and when I tried to stand up, it hurt. It was about 5 days ago.
Okay. 5 days ago. All right, and how would you describe the pain right now? Is it achy, dull, sharp shooting?
Very sharp.
Sharp pain.
Yes.
Okay, would you say that it's gotten better, worse, or stayed the same since it happened 5 days ago?
It's getting better slowly.
Getting better slowly, okay. And if you could rate it on a scale of 0 to 10, 0 being no pain, 10 being the worst pain ever, how would you rate your pain right now?
Right now it's 6.
6. What about at its best?
Also a 6.
6.
Doesn't get any better.
How about its worst?
I'd say that's about an 8.
An 8, all right. Does it radiate anywhere, or does it stay right in that area?
It stays put.
Okay. Is there a setting, anything in the environment, any stressors, anything that makes the discomfort come out more?
Not that I've noticed.
No? Okay. How about timing? When it comes, is it a constant pain? Does it come and go?
It's been very constant.
Constant?
Yeah.
Okay. Is there a time of day that it's better or worse?
I'd say lately, the last few days, midday has been the worst.
Midday is the worst.
Yeah.
Is there any time that it's better?
Not that I've
No,
noticed.
don't notice anything? Okay. Have you ever felt this pain before, or is this the first time
This
that
would
you
be
felt this kind of pain?
first time.
First time. And is there anything that you've done that you have found to make it better? Any ice heating, anything like that?
Laying down a little bit helps.
Laying down helps. Anything else?
Just that if I sit for a long time, it gets worse.
Sitting gets worse.
Yeah.
Okay. And have you seen anybody else before coming to me?
No.
No.
You're my first.
First person. And your activities of daily living, have you noticed any change there? Shopping, doing yard work, anything like that?
Just mostly like sitting in class is more uncomfortable and pretty cautious about doing things where I'm bending over. It's hard.
Okay. Have you noticed any other associated symptoms since this happened?
Not that I can think of.
We're going to get into a couple red flags here, okay?
Okay.
Have you noticed that you fatigue more in the recent past? No.
No.
Do you notice any changes in your weight in the last 12 months?
Mm-mm.
Any changes in your appetite or thirst?
No.
No. Okay. How about fever, sweat, and chills recently?
No.
No.
None.
Any pain that wakes you up at night, or any pain that doesn't change with position?
No.
Okay. And then, do you notice that you bruise or bleed more easily at all?
No.
No?
No.
All right. It's good to hear. All right, we're gonna do some past and current history now. Okay.
Okay,
All right. Diana, you ready?
I'm ready.
Okay. Have you had any surgeries?
I have. I had my wisdom teeth removed.
Okay. When was that?
I was 17.
17. Any residual effects from that since then?
No, I didn't have any problems.
Have you had any other accidents or injuries other than what we've talked about? Any breaks, any strains, sprains, car accidents, anything like that?
No.
No? Have you had any illnesses or hospitalizations that we haven't talked about? Okay. Any medications, supplements, or vaccinations recently?
I take symptom every day, just one of them.
Centrum?
Yep.
Okay. One per day. How long you been taking that? Do you know?
No, I don't really remember.
All right. It's okay. And then, how many hours of uninterrupted sleep would you say you get per night?
I'm good about getting 8 hours.
8
every night.
hours.
Yep.
Okay. Do you feel well rested when you wake up?
Yeah, very much so.
All right. That's good. Do you take caffeine? Do you drink caffeine at all? Coffee, pop?
Nope.
No. What's a typical breakfast, lunch, and dinner for you in a day?
Let's see. So normally every morning I start with toast, just a salad for lunch, and normally chicken and vegetables for dinner. I gotta say, sometimes I have Oreos for a snack though, but
Dinner was chicken, you said?
chicken and vegetables.
Chicken and veggies.
Pretty.
Some Oreos for a snack. I like it.
Gotta do it.
Yep. All right. Do you use tobacco?
Nope.
No. Does anybody around you smoke or use tobacco? Okay. Do you drink alcohol?
I do.
How often would you say? How many drinks do you think you have per week?
Oh, I have a big margarita every Friday, but I don't really know how big it is. It's one of these deals.
Okay, just a big thing.
Big old margarita.
Getting the stress from work, huh?
Yep.
Right. And have you ever used an unprescribed medicine or any recreational drugs?
I haven't.
No. Okay. Do you exercise?
No, I don't.
No exercise. What's some of your hobbies?
I don't really have any. I just study all the time.
Study. Okay. In school. Do you use protective equipment when it's provided to you? You know, seat belts, helmets, things like that.
I use seatbelts when I drive.
Okay.
Other than that, no. That's about the only safety equipment I use.
All right. What jobs have you had?
Well, I'm currently a student, but in the past I used to work at Taco John's.
Okay.
Of course, that's better than Taco Bell.
Oh yeah. Taco John's is one of the best. What else do we got for you? Do you feel like you have a safe home life? Do you have a good support system?
Yeah.
Yeah. Okay. Any history of domestic violence?
No.
All right. And then I'm going to ask you a few questions about your family history, okay? Your family health conditions.
Oh, okay.
All right. Do you know who your biological family is?
I do.
You do. Okay. Does your parents have ever had any health conditions?
Not that I'm aware of.
No. Okay. How about your grandparents?
Grandmother had diabetes, and my grandpa had a heart attack.
Grandpa had a heart attack.
That's about it, though.
Okay. How about any siblings? Do you have any brothers or sisters?
I do have siblings.
Do they have any health conditions at all?
Not that I don't think so.
All right. Do you have any children?
No kids.
Okay. That's good. 25. Live while you're young.
Yeah.
All right. Now we're going to do some review of systems, okay? All right. So we're going to get into your skin first. Do you notice any rashing or itching on your skin?
No.
Okay. Any moles that you've seen change in the past 12 months? You ever get your moles checked? Have you ever had them checked?
Actually, I never have had them
No.
checked.
Any changes in color in your hair, skin, nails? Anything like that?
No.
Nothing. Okay. Have you ever had any problems with your head? Any concussions, trauma, lightheadedness, dizziness, vertigo, anything like that?
Never had anything like that, no.
Awesome. Your ears, have you ever had ringing in the ears, loss of hearing, ear infections? Nothing?
No.
Alright. Your eyes, have you ever had double vision, blurred vision, loss of vision, any bright flashes?
None of that, no.
Do you have contacts, glasses?
No.
Nothing. Alrighty. Getting your nose. Have you ever had any issues with your nose? Deviated septum, nose bleeds, nose infections, allergies, sinus infections, anything like that
No.
you can think of?
Never had anything.
Awesome. Okay. And then your mouth and throat here. Do you ever have sore throat, difficulty swallowing or speaking? Nothing?
No.
Okay. How about cavities? Any cavities?
No
Braces?
cavities.
No jaw pain, locking, anything like that?
Nope.
Nothing? Okay. Any sores or any... Have you ever had braces or any sores?
No braces,
No
but
braces.
I did have a canker sore years ago, and just kind of went away.
Didn't do anything, it just went away?
Yeah,
Okay.
come and go.
Yep. Alright, ask you a couple questions about your heart.
Okay.
Have you ever had chest pain, difficulty breathing, or anything with exertion?
No,
Okay.
nothing.
Has it ever felt like your heart's gonna just pound right out of your chest?
No.
No. Okay. How about cold hands or feet with basically like a relatively normal environment around you?
So like this room?
Yeah, nothing like that.
No.
Changes in color, hands and feet ever, from like a white to let's say like purple blue, or bluish?
No.
Nothing. Good.
That doesn't sound good though.
Nope. So, a little bit on your lungs here. Do you have history of asthma, pneumonia, anything like that?
Nope.
Okay, have you ever coughed up anything that you felt was a little bit weird? You know, looking, maybe the color.
No.
Okay, beautiful. All right, your GI. Have you ever had no difficulty swallowing? You said heartburn, upper or lower ab pain, anything like that?
No.
Bloody vomits?
No.
No. All right. And then, how often do you pass bowel movement?
Once a day normally.
Once a day.
Yeah.
What color would you say they are? Green, brown,
Brown.
brown. What the consistency? It's a little weird question, but everything's important.
just-
Is it skinny, logs,
Skinny but long.
skinny, long?
Yeah.
Alright. Okay. And then any troubles with urination? Have you seen any changes in your urine output, color recently?
No.
How often would you say you go per day?
About 4 times.
4 times a day.
Yes, sir.
All right. Do you have a history of UTIs?
No.
No. Okay. Now we're gonna get a little more personal questions,
Okay.
but it's all confidential, so I need you to be honest. Okay.
Okay.
All right. Are you sexually active?
Not right now.
Okay. So protection. So no genital infections
Nope.
that you're aware of. All right, and then we're gonna get into some questions again, just for you.
Okay.
Okay, for females. All right. Do you have a regular menstrual cycle?
Yes.
Yes. How long does the cycle last?
It's normally 28 days.
28 days. How long does your period usually last?
5.
5 days. Any heavy clotting or bleeding?
Nope.
Okay. No intercourse is painful. Have you or are you on birth control right now?
No.
No birth control. Have you ever had hot flashes? No. Okay. Have you ever been pregnant?
Nope.
No. Have you ever had a pap smear?
Last year I did.
Last year. Any abnormal findings?
Nope.
Okay. No pregnancies, no births. Do you perform self-breast exams?
No, I've never done that.
No.
Mm-mm.
Okay, so you have never noticed anything abnormal, obviously.
Nope.
You ever have any discharge? No. Alrighty. Now we're gonna go on to your neuromuscular, any joint pain, ligament, bone pain that we haven't talked about.
No.
No, swelling, arthritis, anything like that. Okay. Pain in the calf when walking. Swelling of the limbs. Nothing?
No.
All right.
Nothing there.
Endocrine. Have you ever had any issues with your thyroid or history of diabetes?
No.
Any enlarged glands? Frequent infections? No. Any frequent fractures?
Nope.
No. Okay. Neurological. Have you ever had any seizures?
I haven't. No.
No. Have you ever had shaking or tremors?
Mm-mm.
No. Any loss of sensation anywhere? Altered sensation? Any tingling, numbness?
No.
No. All right. And then, last but not least, have you ever had any anxiety or depression?
I haven't.
No. Okay. Any troubles falling asleep, waking you up at night?
Mm-mm.
No? All right. We're all done then. Thanks, Dinah.
Thank you.
Very nice to meet you. To go through these things and have you come back in a couple days, okay?
Okay.